Our next speaker is Lucy Lee. Lucy Lee is from Chan Zuckerberg Biohub and is going to be speaking on tools for estimating unreported infections of COVID-19. Lucy, please share your slides, which I see you have, and take it away. Thank you.
I work on the data science team at the Chan Zuckerberg Biohub based in San Francisco. I'm particularly interested in combining pathogen genomic analyses with mathematical modeling and machine learning approaches to help understand the transmission of infectious diseases. So I'll spend the next few minutes talking not about the COVID infections that we observe, but rather those that we cannot detect, and discuss why it's important to quantify the number of undetected infections. So not all infections are detected by healthcare systems. This can be because the symptoms are too mild for the infected individuals to seek healthcare, or there's a limit on the number of tests that can be performed, or there could be restrictive criteria for selecting individuals for testing. Regardless of the reason, the consequence of a large number of undetected infections is that infections can spread latently through the population, which is a problem when those infections end up in vulnerable individuals. Furthermore, this also facilitates pathogen spread across large geographical distances when those infected individuals are able to travel when they are infectious. And lastly, when considering eliminating a disease from a region, it takes much longer to be certain that the disease is gone. So how can we estimate the number of undetected COVID infections? The most obvious solution is to do more testing, not just of symptomatic individuals, but of the population at large. I highlight here a few examples in Washington, in South Korea, and on board the Diamond Princess cruise ship. These methods are very useful for quantifying how many cases are asymptomatic or mildly symptomatic. However, this process is obviously very expensive and time-consuming and may not be doable when resources are already constrained. So besides trying to directly detect the usually undetected infections, we can use modeling to infer what those numbers are based on when and where infections occur. I highlight here a couple of examples of this approach to quantify the number of undetected infections, both of which found very low rates of detection based on early pandemic data. However, there's usually a great deal of uncertainty in modeling results at the start of a pandemic. Adding in additional sources of data can improve the accuracy and precision of estimates and reduce potential biases from single sources of data. So besides case count data, another source of data that is informative of the number of undetected infections is the virus itself. I link here a blog post by Trevor Bedford, the founder of NextStrain, who did some back-of-the-envelope calculations to infer how many undetected transmissions had occurred in Washington by March. So what information is contained in the virus that allows us to estimate the number of undetected? Let's assume for a moment that we're able to test every single individual and track every single transmission in the population. If we sequence the viral genome, we can see that it mutates as it transmits through the population. This is a process that happens to all living organisms. Every time DNA is replicated, there's a chance of mutation. The viral genome, after many rounds of transmission, starts to look different from the original virus that infected the population. Now, let's assume we are only able to test 1 in 4 infected individuals. If we know how quickly the virus mutates, we can infer how many missing transmissions could have occurred between the tested cases. So in my work, I modeled both the time series of case counts at the start of the epidemic, as well as the viral genomic diversity to quantify the number of undetected infections. The viral genomic data are represented here by a tree. Each tip on the tree represents a viral genome, and the closer the viral genomes are on the tree, the more related they are. So using just data from Hubei, the province in which Wuhan is located, I found that only about 1 in 7 infections were detected in the reported time series. Once adding in infections outside of China, that number was potentially as low as 1 in 20. This large number of undetected infections is in the same ballpark as what was reported in the other modeling studies I referenced earlier. This means that by the time 100 confirmed cases are in the community, there could be as much as 1,000 other infected individuals who are not symptomatic enough to be hospitalized and could transmit the disease undetected. This is why, in the absence of a vaccine, population-wide social distancing is needed to get the case numbers down. Since I started the analysis of this pandemic data, the epicenter of the pandemic has shifted to other parts of the world. So the next step in my work is to use this approach to quantify the undetected numbers in different countries and regions and elucidate what fraction of the undetected cases is due to mild symptoms versus limited testing capacity. Another implication of this large number of undetected infections is in the recommendation for face mask usage. So this article just came out in the New York Times that highlights the significant role that asymptomatic or mildly symptomatic cases play in continued transmission of COVID-19. And this may lead the CDC to recommend broadened usage of face masks in certain public areas, such as supermarkets. So before I finish, I wanted to highlight some of the other COVID-related work that is happening at the Biohub, which for those of you who are not familiar, is a nonprofit biomedical research organization based in San Francisco. So recently, the Biohub became one of the COVID testing labs, helping to expand the testing capacity in the Bay Area. In addition to diagnostic testing, we're also interested in a number of research questions involving the analysis of both pathogen and host data. So in the interest of time, I won't read out all of these names, but I want to make sure I acknowledge the contribution of these groups of people, as well as the research and medical communities globally who are coming together to improve our knowledge of this pandemic disease. Thank you.
Thank you very much, Lucy.